Good morning, everybody. It's always exciting to talk to a hungry for a knowledge and action crowd. I will be talking about the cognitive part of the Chiari malformation, and just to get that out of the way, the cognitive means the higher brain function. That includes our attention, concentration, memory, thinking, language, all of these functions. When I started preparing for this talk, I looked at what are the main or what are the most frequent complaints patients present when cognitive complaints when they have Chiari malformation. And probably the term such as a brain fog comes up frequently. I feel like in a brain fog, I cannot concentrate, I'm like out, I'm spaced out. And looking into the whole topic, let me tell you the secret. The whole topic is in the fog. We really do not know why are people having these complaints. It's not easy to study Chiari from the cognitive perspective because there are several factors which are working. One factor what Dr. Nemchinsky demonstrated is changes in the flow in the skull, inside the brain, and these changes in the fluctuations in the pressures, and especially if somebody is developing hydrocephalus on its own can have a very bad consequences for our attention, for our memory. On its own, Chiari is considered a developmental disorder. So meaning do we know everything from the developmental, anatomical, microstructural perspective, what's happening in the brain in the Chiari malformation. The way I set this presentation is, if the Chiari malformation, one of the centerpieces is the cerebellar malformation, cerebellar descent, or underdevelopment, is there any evidence that that part of the brain, the cerebellum, plays a role in the cognition? Because for ages, literally everybody thought that that part of the brain was mostly involved only in the motor function. So we'll review what's available, whether the cerebellum is a part of the cognitive network. And there is a condition which was coined recently, which is called cerebellar cognitive affective disorder, which we will review and see whether that fits in also in the context of the Chiari malformation. I'm going to quickly review what are the types of the Chiari malformation, what is the evidence of cognitive impairment in the Chiari malformation, does the treatment of the malformation improve the cognition, and what are non-invasive brain stimulation in the cerebellar disorders, and can it actually be applied to somebody who has a Chiari malformation. So, Arnold-Chiari Malformation is a distinct group of developmental disorders unified by one feature, the cerebellum protruding in the spinal canal. It's frequently in the pure Chiari 1, this is the main feature, plus the secondary flow abnormalities. Chiari 2, 3, 4 have other plus features. There are 4 types right now. The type 1 presents with the extension of the cerebellar tonsils through the foramen magnum. The type 2 presents with the extension of the cerebellum and brainstem through foramen magnum and developing myelomeningocele. The type 3 presents with a protrusion and herniation of the cerebellum and brainstem through the foramen magnum, and sometimes the cerebellum might herniate and protrude into occipital encephalocele. And type 4 is underdeveloped on undeveloped cerebellum. These are the pictures. These are not the best quality. When I'm going after Dr. Nemchinsky, I think these are like a kiddie pictures when it comes to the Chiari malformation. But overall, as you see the low-laying cerebellum, again, low-laying cerebellum, probably some brainstem protrusion as well. So, microstructural abnormalities of the Chiari malformation are not clearly defined, and I am talking separately from the flow abnormalities, separately from the pressure abnormalities, whether there is anything microstructurally where the nerve cells are connected differently. If it is a developmental disorder, what would give a basis for our problems with the attention, concentration, and memory? Some patients with a Chiari malformation develop hydrocephalus, which in its own can cause significant attention memory impairment, and this is something actually what needs to be excluded immediately if somebody starts complaining of the memory and attention problems. This is a very exacerbated picture of it. On the left, on the right, I'm sorry, there is a normal brain with a normal sized ventricles. On the left, the ventricles are humongous. Again, this is just a really exacerbated picture. Now, many patients with a Chiari malformation complain of varying degrees of the attention and memory impairment. Despite that, not much is known about the etiology of these symptoms. Frequent complaints include feeling foggy, having a brain fog, spaced out, or losing mental sharpness. These complaints signify changes in awareness and a development of which is not clear at all. Some authors have suggested that the cognitive complaints possibly stem from other than necessarily our network dysfunction in the brain, such as chronic pain, which can affect our attention concentration. When we're in pain, we really don't concentrate very well. We're not attending to things, and that's normal. Concomitant mood disorder, such as depression, again, can cause a significant attention impairment. People who are very depressed, they might look like they're demented, hence the term pseudo-dementia. Or medications used to treat any of the above conditions. This view probably does not explain the whole spectrum of the reported symptoms. The anatomy of the Chiari malformation. The Chiari malformation presents with a various degree cerebellar involvement with or without other structural abnormalities. The true microstructural abnormalities, again, are not truly defined. So we do not have a very good anatomical basis to study the complaints. So if cerebellum is one of the main part of this condition, do we have any evidence that the cerebellum is involved in the cognitive processing? And up until the end of the last century, it was believed that cerebellum is only involved in the motor function. And the evidence is mounting that that part of the brain actually contributes to the cognitive processing and behavioral control. The anatomical studies, and I'm specifically citing the study cerebellar projection to the prefrontal cortex. Prefrontal cortex is just part of our front of the brain, frontal lobes. That's what makes us human. The anatomical studies demonstrated that actually the cerebellum projects to the prefrontal areas of the brain, which in turn are responsible for cognitive planning, for working memory, and many other functions. Cerebellum also has connections with the posterior parietal lobes, superior temporal lobes, parahippocampal areas. These are all areas which are highly involved in the memory processing, highly involved, again, in the visual spatial processing. So the connections are bidirectional, meaning that cerebellum sends the connections to those parts of the brain, and those parts of the brain are influencing cerebellar function as well. So there is an anatomical basis for us to say that cerebellum is possibly involved. We don't know the degree in our attention and our concentration. Cerebellum also has the connections with hypothalamus, and hypothalamus is involved in, it regulates our primal behaviors. And all these connections incorporate the cerebellum in the loops governing our cognition, intellect, and behavior. And so studies demonstrate that cerebellum is involved in cognition. The strength of the influence is really unclear. Now, functional imaging of cerebellum during tasks showed that the cerebellum does activate during our cognitive task. It is active during mental imagery task. It is active during our learning and memory. It is active during the linguistic processing, attentional modulation, executive function, and visual spatial processing. Visual spatial processing is just higher visual processing. The universal manifestation of cerebellar impairment is dysmetria. Dysmetria is just an inability to coordinate very fine movements. For example, if we're reaching for something, at the very end, we really cannot coordinate those, the fine-tune the movements. Now, Dr. Schmamann has coined the term dysmetria of thought, which presents with various components of cognitive behavioral changes in people who have cerebellar problems, meaning that they cannot fine-tune their thoughts. Of note, this is a little bit more of the philosophical approach, but at least, this is a good starting point to work on it. He was the one also who coined the term cerebellar cognitive affective disorder. That the term was introduced in 1998. The authors have reported that patients with the cerebellar lesions had these deficits: executive function, difficulty with the planning, with set shifting, abstract reasoning, working memory, visual spatial organization, personality changes, and language deficits. Again, I'm not talking this is specifically about Chiari. I'm just grasping for evidence whether the centerpiece of the Chiari malformation has evidence that it is involved in the cognition. Some children who underwent resection of the cerebellar tumors also developed this disorder. The deficits involved language, executive function, memory, visual spatial function, and changes in children personalities were also reported. There are also several reports about cerebellar involvement in the attention deficit hyperactivity disorder, and attention deficit disorder sometimes is being diagnosed also in the people with a Chiari malformation. And some structural studies using the MRI demonstrated that posterior lobes of the vermis, which is just a part of the cerebellum, were smaller in patients suffering from the ADHD. So what do we know about the cognitive function actually in the Arnold-Chiari malformation? And the study by the Kumar, which was published in the World Neurosurgery in 2011, they demonstrated that there were some white matter microstructural abnormalities in several brain structures other than cerebellum. So they expanded the spectrum that this developmental disorder, maybe it extends beyond the cerebellum, and it also involves other parts of the brain microstructurally. And these abnormalities did correlate with the performance on certain neurological tests. There are some parts of the study where the study is not very clean. There are some parts of the study which we can argue about, but this was the first evidence that actually maybe Arnold-Chiari has some changes, microstructural changes, somewhere else in the brain apart from the cerebellum. Now, just from the anatomical perspective, these tracts, white matter tracts, are very sensitive to the pressure changes in the skull, and question whether the flow abnormalities actually are causing these, or whether it's truly the developmental problem. Another study from 2008 demonstrated that patients with Chiari 1 demonstrated deficits in memory and retrieval skills. Many of these people had depression, but when they corrected for the depression could not account for these findings. Now, in the Chiari 2, which is a little bit different than Chiari 1 in the complexity, there was one study from 2009 which demonstrated that there were changes in the certain fibers pointing toward the developmental abnormalities. Again, the fibers, they didn't mention that these are the fibers these are the areas of the brain which are very sensitive to the changes in the flow, in the cerebrospinal fluid flow. And neuropsychological abnormalities primarily affected higher visual function, followed by verbal memory impairment. Another study compared two patients, actually it's two patient groups, not two patients. Two patient group, this Smina bifida group, and the first group had a Chiari and the other one did not. And the patients who had a Chiari without hydrocephalus demonstrated diminished in the performance and total IQ scores. Now, Chiari 2, hydrocephalus and cognition. The study published in 2006 investigated children with a Chiari 2 who had hydrocephalus and were treated with a shunt. The study demonstrated abnormalities in the specific white matter tracts. Again, this study definitely lacks specificity for the Chiari 2 because it's probably more specific for hydrocephalus than for Chiari 2. Not all studies demonstrate cognitive impairment in patients with a Chiari malformation. So that's where it comes in. When I said initially that the whole topic is in fog because there are some studies which actually do not demonstrate cognitive impairment. And this questions the methodological, whether the study was done correctly methodologically, and the sensitivity of the test. of the chosen tests which were used for the study. There are also patients who have cognitive symptoms, though no impairment is found during standard clinical evaluation. So the patient presents with the complaints, but when you test, they're performing in the average or normal range, which raises the possibility that the available office-based tests do not measure up to a real-life cognitive performance, to a real-life cognitive demands, and or that these tests might not have sensitivity applicable to the specific patient population. Hydrocephalus. Hydrocephalus can be a part of Chiari 2, 3, very rarely 1, is condition during which the cerebrospinal fluid starts accumulating inside the ventricles, causing increased intracranial pressure, which in turn starts damaging the brain tissue. So what we know that hydrocephalus by itself causes impaired cognitive function, primarily in the attention, frontal lobe functions, memory domains, and information processing speed. What we know, and where there is a clear evidence that treatment of the hydrocephalus prevents further cognitive decline and reverse some of or all of the cognitive dysfunction stemming from that. So does the treatment of Chiari improve the cognition? And unfortunately, there is no data to answer this question. There is a report of 2 patients from 2011, which is very conflicting. There are 2 children who had Chiari malformation. Both of them were treated, and one child's language has improved after surgery, but behavior continued to deteriorate. I don't think anybody knows why and what that even means. And the other child's attention has improved, but language has worsened. So again, if it is so sketchy that definitely we cannot make any conclusion out of these 2 reports, but there is some improvement in some cases and non-improvement in the other cases. And does the treatment of hydrocephalus, as I mentioned, if one is present, was for sure shown to stop cognitive worsening and frequently reverse already present impairments. And I'm just going to throw this in. It's not something that is being used, but I think that would be a very good approach to study the cognition and involvement of the cognition in the Arnold-Chiari and whether anything can be done about it if there is involvement. That's non-invasive brain stimulation, and it's by the electromagnetic fields. Non-invasive brain stimulation techniques involve the use of the transcranial magnetic stimulation or direct current stimulation with the goal of changing activity in the certain brain networks. And some data suggest that using transcranial magnetic stimulation might improve cognitive symptoms in patients with cerebellar disorders. Some of it is lasting, some of it is not lasting. And these techniques were tested in patients with ataxia and cerebellar cognitive affective disorder. Again, it was not tested in the patients with a Chiari malformation. There is still a lot to explore in order to define the exact mechanism involved in the cognitive impairment in patients. And understanding these mechanisms will definitely help construct the treatment plan for these patients. Thank you.